Here's kind of a concept that's been floating around. If you could only teach one part of bleeding control or stop the bleed, what would it be? So direct pressure, wound packing, or tourniquet application?
Well, as a contrarian, I'm not going to accept that question. And the reason is because there's two types of bleeding, right? There's the bleeding that as a certain, I kind of call it irritating. It's irritating. There's bleeding, but it's not fatal. And that is the vast majority of bleeding. And that is the bleeding that you can control with pressure and gauze dressing. But then there's the fatal bleeding that pressure and gauze dressing doesn't work well for, and that requires a tourniquet. And so I would ask your question. You're asking a question about one. I'm going to give you an answer that's two. If it's bad, then you need a tourniquet, and you need it first. I would not do pressure on that one. Right? But the majority of bleeding can be taken care of by pressure and gauze.
Okay, so it's just vital that they understand what is life-threatening hemorrhage and what needs a tourniquet versus I can control this with direct pressure.
And when we did the Stop the Bleed program with Surf Like That, we spent a lot of time on that concept, and the Stop the Bleed program kind of wants you to understand, granted it is sometimes difficult to tell the difference between irritating, oozing, and life-threatening bleeding. I would always err on the side of putting a tourniquet on so that you'll have tourniquets put on in patients who, when they arrive in the hospital, when they're up on the gurney and have all the lights and we sort it all out, in hindsight didn't have life-threatening bleeding, but it's better to over-triage than under-triage. If we under-triage and don't put tourniquets on patients who needed them, we know from the military data and we know from civilian data that we've published out of our hospital that patients will die unnecessarily.